Hi, this is facial video number 9, basic facial video number 9. And we're going to start by talking about what we do before the client even arrives to prepare. So we're going to disinfect our workstation, the bed, and any equipment before using a disinfectant wipe following manufacturer's instructions. We're going to check all of our equipment to ensure that the devices are in safe working order and plugged into a working receptacle. We're going to gather clean supplies that are needed for the facial service, storing in a clean, closed container. We're going to turn on the hot cabbie and stock with at least 3 clean, wet towels. More may be needed depending on the service and the client's needs. We will fill a clean steamer glass with distilled water, and we're going to turn on and preheat the steamer, so we preheat it. We will dispense the products that we need for the service according to the skin type and client's needs as followed. So we're going to prepare disposable portion cups or trays for each product with a portion of the product by opening the top of the container and ensuring that the tip of the nozzle does not come into contact with a disposable portion cup or tray. Or you can remove the product with a disinfected or clean single-use spatula like this. And then when you're done, you toss it and put the lid back on the product. And then you would set the portion cup on the tray. You would drape your facial bed using a fitted sheet and a flat sheet, and you also need 3 towels. So you're going to place the laundered sheets on the facial bed, and then you're going to place a towel horizontally on the head of the bed. You're going to lay a hairnet and a headband on top of the first towel, along with a rolled towel to support the head and neck of the client, and save the 3rd towel to lay across the client's décolleté. So, and I've also already done all my prep, my little cups. And I have disposable gloves, I have my cotton rounds and squares, water, all the things that I need to perform my service. And then my client is getting ready to arrive if my camera doesn't fall down. So my client has arrived, and I will escort her to our work area, and we're going to talk first. And then what we do is I've welcomed her, I've determined the preferences of the client, and now I have to assess the client's needs. I'm going to assess the client's skin by performing a visual skin analysis to ensure that there is no inflamed, infected, broken, raised, or swollen skin in the area that needs to be worked on or that we're working on, or an open wound or sore in the area to be worked on, infection or infestation like lice to prevent from safely performing the service. We're going to assess the client's consultation form for any medications and products used within the last 72 hours. We're going to consult on any known allergies. We're going to consult with the client on any facial surgeries that they have had within the last 3 months, and if the client is under physician's care. We're going to assess if the client is prone to cold sores or fever blisters. We'll assess if the client has used exfoliating or lightening agents within the last 72 hours, like alpha hydroxy acids, beta hydroxy acids, hydroquinone, etc. Always recommending sunscreen. We're going to assess facial injections within the last 3 weeks, like Botox or hyaluronic fillers. If the client is free of any of the above contraindications, we can move forward with the procedure. So let's get her ready. When I met her, I had clean hands. I already had cleaned my hands, so we're going to get her ready, and then I'm going to wash my hands again. So we give the client some privacy. We let her disrobe for the service, and she puts on her cape, and then she has come to the bed. So she's laying down, and I comfortably tuck her in. She's laid on the towel, but I'm going to take my rolled towel now and place it under her neck to support her a little bit better. I've got a headband right here that I'm going to put on her that will probably not stay on her, but we are going to set up correctly. And this would keep her hair back from getting product or water on it. And then here's the towel that I'm going to use, the third towel for her décolleté. Okay, now, before I perform the service, I wash my hands. So I turn on the water and I wet them, and then I get a coin size liquid soap and I wash them. I wash my palm, both palms all the way down to my wrist. Then I wash the back of my hands. Then I'm gonna wash all my fingers, going in between each finger, giving that care, the backs of each finger, making sure that we're interlacing them, rubbing them together underneath the water with the lather for at least 20 to 30 seconds minimum. We're gonna clean our fingertips and our fingernails, our thumbs, our wrists, and then we'll rinse them thoroughly under the water. Once they have had a proper rinse, we take a paper towel and we turn the water off with the paper towel. We dry our hands thoroughly. And once you feel like your hands are dry, you have to then grab your hand sanitizer and you will sanitize your hands. That will complete your hand washing step. And then you can begin the facial procedure. Time for the first cleanse. headband is officially off down there. Okay, so let me remove this cleanser real quick. So I have to get my magnifying lamp. So what I'm going to do is cover her eyes. And I'm going to bring my magnifying lamp over. Oop, I brought it over and I turned the light on. Now I'm performing a skin analysis. So what I'm doing really is looking for things like flaky skin, fine lines, freckles, abrasions, excess sebum. I'm just taking a minute to investigate anything. But my girl looks great. She feels like the fine lines are coming, so she's really focusing on anti-aging and doing better things for her skin. But as far as other things, I think her skin looks amazing, which is great news for her. But it helps me also while I'm analyzing, I think about like her maintenance or aftercare, etc., like what I'm going to recommend once the facial is done. So we are moving the implement, or the machine, excuse me, back to, or moving it out of the way, turning that light off, and we can take the cotton pads off and throw them away. So time for cleanse number 2. Cleanse number 3. Trashed it. She is getting clean today. Okay, she's cleansed. Now we need to tone her. exfoliate. So with your exfoliator, you're massaging it in for 1 to 2 minutes based on type and recommendation from the manufacturer, etc. And now you would want to retrieve your steamer, which we're going to pretend because I don't have that. So we're going to retrieve our steamer and turn it on. It will be facing away from the client because it emits a mist, and so we got to wait until it's ready to position it towards the client. So once the steamer has heated up and it emits an even outflow of a mist, we're going to turn the steamer towards the client, and we're going to position it 16 inches over the client's face, aim it at the client's chin for even distribution of the mist. And we would allow the steamer to function for 3 to 5 minutes, and then we would turn it off and return it to where it was being stored for disinfection. So for the sake of the video, we're not going to do that. We don't have the steamer, and we're just going to progress to the next step. We'll pretend like we did the steam. So we're going to use actually a towel out of our cabbie, and we're going to go over and get it, and we're going to think, oh gosh, a hot towel. So what are we going to do? We're going to open it up, and we are going to check it on our wrists. We're going to check it on our client's collarbone once we feel like it's a good fit. Yes, that feels great. And then we are going to place it on the client. We are going to keep her nose out. So she can breathe. Now that the exfoliator's been removed, I'm going to put on a pair of gloves. This was the time for extractions. Disposable gloves. And you can either use cotton rounds soaked in antiseptic with your finger, or you can use wooden tipped Q-tips soaked in antiseptic, which is what I'm going to use. You have to throw each pair out after you do each extraction, so you can't use it for multiple extractions. Getting another set. Throwing those away, getting a third set. She's pretty good. This is her last one. You would not want to do this any longer than 5 to 7 minutes on a client because it's uncomfortable. And throwing that one out. So I'm going to throw my gloves away. And we are going to tone. Well, great news after extraction. That painful part, she's going to the best part, which is massage. So So I just applied the mask after the massage and removal of the massage product. With a facial mask, we will look at the manufacturer's directions, but they would normally sit on the face for 5 to 10 minutes, which we are filming video, so we're not going to do that. So what we're going to do right now is remove it. I was cautious not to get it in the eyes or the nose or the mouth. So we're going to remove our facial mask. I apparently put on a lot of mask or a lot of mask remover. Just making sure I get all of it off. And she looks amazing, absolutely amazing. So now I just have to finish her skin. So we're going to do a teensy bit of eye cream, and we're going to of course apply it with our ring finger, and we're going to apply it to the zygomatic arch and the brow bone. And we need moisturizer, and the sun is still up, so we're going to use one with SPF, and we're going to apply it everywhere that she could be exposed when she leaves her facial today. So clearly her face, it's going to be on her face, it's going to be on, I would even do it on her ears if she has short hair, her ears would be exposed, her neck, her chest or décolleté, just in case that's out. And that's the end of her facial. At that point, I would give her some privacy and let her get dressed, and then we would meet and discuss maintenance and aftercare, and I'd get her out the door. And then I have to come back and clean up. So single-use items are discarded. We would place implements in a closed container that says to be disinfected, such as this, that I used. We would place the sheets, the towels, and her cape into a closed container until time for laundry. Work area needs to be clean and disinfected. So I would identify proper cleaning agent and read manufacturer's directions. I would follow manufacturer's directions for mixing and usage. Then I would wipe my workstation and area with the cleaning solution to remove any debris. I then would identify a disinfectant that is bactericidal, virucidal, and fungicidal and EPA approved for use in a salon setting. I would follow manufacturer's directions for mixing and or using appropriate aerosol disinfectant. I would disinfect electrical equipment, store it in a clean area separate from other implements. And then obviously if I had gloves on, I would remove those and throw them away. The last thing that I would need to do is wash my hands. So I would turn on the water and wet them, and I would apply liquid hand soap, and I would rub my palms together all the way down to my wrists. I would wash the back of my hands. I would wash my fingers, all of my fingers, in between my fingers, obviously the fronts of my fingers, the backs of my fingers, in between my fingers, in between my thumbs and my fingers, my nails and my fingertips need to be cleaned as well, thumbs, all while 20 to 30 seconds at least, if not more, under the water, and then going down to my wrist, washing there, and then I would be thoroughly rinsing them off underneath the water. Once they've had a proper rinse, I would grab a paper towel and then turn off the water with the hand that has the paper towel. Then I would dry my hands completely with paper towels, throw it away, and then in order to finish washing my hands, I would be grabbing hand sanitizer and sanitizing my hands, of course, like you wash them. To finish out my basic facial video number 9. So everything's clean, all of this is gone, everything's been sanitized and disinfected. The room is ready. Either you can start setting up for a new client or you are done for the day.